Hi, my name is Sydney Nimps, and I'm going to be doing my presentation for cellular biology on the drug tamoxifen. So let's get started. The first slide that I'm going to be talking about is the mechanism of action for tamoxifen. So this figure is a figure that I pulled from the textbook. It shows the 4 classifications of breast cancer and the different prognoses of each of those. The luminal A and B subtypes in which steroid hormones are overexpressed can be successfully treated with drugs like tamoxifen because it is able to block steroid hormone receptors. These drugs work by attaching to estrogen receptors in breast cells, blocking estrogen's ability to cause cellular mutations that lead to cancer. It only works against cancers that are estrogen receptor positive or progesterone receptor positive. The mechanism of action is by its binding to the estrogen receptor along with the blocking of the proliferative actions of estrogen on mammary epithelium. Tamoxifen is formally known as a selective estrogen receptor modulator, or SERM. By blocking estrogen in the breast, tamoxifen helps slow the growth and reproduction of breast cancer cells. This mechanism appears to have cytostatic effects, causing cells to accumulate in the G0 and G1 phases. One suggested mechanism for this action is the induction by tamoxifen of the synthesis of the cytokine transforming growth factor, which acts as a negative autocrine regulatory molecule. However, it has also been shown that tamoxifen can induce synthesis of those cancers. Next slide, I'm going to be talking about the pathway, and how tamoxifen interferes with that pathway. Tamoxifen interferes with the insulin-like growth factor, I receptor, also known as IGF-IR, in breast cancer cells. The insulin-like growth factor I receptor is involved in the control of breast cancer cell growth. So in normal cells, this pathway, the IGFs are essential for growth and survival, that suppress apoptosis and promote cell cycle progression, angiogenesis, and metastatic activities in various cancers. The IGF family is comprised of insulin and 2 factors similar to insulin termed IGF-1 and IGF-2. So for the pathway in cancer cells, tumors express many of the IGF binding proteins which modulate IGF action and IGF receptors, which mediate the effects of IGFs on tumors. IGF-1 is a point of convergence for major signaling pathways implicated in breast cancer growth. So side effects, here are some side effects of tamoxifen, as well as what causes the side effects and how these side effects relate to tamoxifen's mechanism of action. So some major side effects while taking tamoxifen include blood clots, stroke, endometrial cancer, bone pain, hot flashes, and depression. What causes these side effects? Tamoxifen can cause fluid retention, which as a result would lead to weight gain. The hot flashes can be believed to be due to a central nervous system antiestrogenic effect causing thermoregulatory dysfunction. Tamoxifen acts like estrogen in the uterus, so it can increase the risk of endometrial cancer, and it also increases your risk of blood clotting, specifically in the legs. How do these relate to tamoxifen's mechanism of action? In most common cases, side effects are similar to the symptoms of menopause. This is because they work by blocking the effects of estrogen on cancer cells. And lastly, I have a topic-related question that I would like to be answered after doing all this research. So referring to my figure from the textbook, the figure on slide 2, I believe, it states that tamoxifen is only able to treat the luminal A and B subtypes of breast cancer, so the first 2 pictures shown. So my question would be, is there a drug that can treat the HER2 and basal-like classifications of breast cancer, which would be the last 2 pictures located in the figure? And if so, what are they and why are they able to work while tamoxifen is not able to work? So that's just a question that I have after doing more research on this drug. And lastly, here are my citations. So thank you so much for listening. I hope you enjoyed this presentation. I really enjoyed getting to research more about this drug that I was not aware of before this class, but I found it really interesting. Thank you.